Everybody's Dr. Eric Balcavage, and I'm joined by my partner, Dr. Erica Riggleman. She's my partner on the podcast, but she has her own partner back home, back in Winchester, Virginia. I gotta let you know, I ordered a tub. I'm redoing my bathroom, and I'm looking at the shipping. Like, when's it coming in? And it said it left Winchester, Virginia.
Oh, really?
On Friday. So that means I'll have it this week. Who would have known that Winchester, Virginia would be the place that they hide soaker tubs? I didn't know. I mean,
apparently they do.
You didn't know either.
I didn't know, no.
All right. So life is good in Winchester, Virginia?
Yes, yeah, everything's going good.
Fantastic. So we're going to talk a little bit today. I think today's a good day for talking and having a discussion about the thyroid connection and gut connection. I think there's a lot of discussion, a lot of talk about those two things, and there's still a lot of questions about it. I mean, people, I think they have misconceptions about what's going on in the gut, the role, the relationship between gut physiology, bacteria, conditions like SIBO, irritable bowel syndrome, and why somebody may develop a thyroid problem, a thyroid condition, Hashimoto's. So I think that's the focus of today's talk. You okay with that?
Yeah, no, I think that's great. And I think timing is perfect given we're moving into the holiday season, and a lot of times, gut health and the things we eat just kind of gets thrown out the window. And, people need to understand that it does play a huge role in not only thyroid physiology, but just overall general everything. Your gut is related to everything, whether that's your brain, your skin. I mean, it doesn't matter what it is. It's very much related to gut function.
Yeah, so there's a massive connection for a number of reasons why healthy gut function and healthy gut physiology becomes really important, because everything essentially comes in through the gut. I mean, you eat food, you have to break it down, and you have to extract the vitamins and the minerals, the amino acids, the fats, so that we can run the machinery, right, to run us. And if there's problems within the GI tract, from stomach acid production to low bile flow to poor pancreatic enzyme output to bacterial dysbiosis to wear down of the mucous membrane layer, the secretory IgA system, what we call another problem called leaky gut syndrome, you're going to have problems absorbing the key nutrients that the body needs, the cells need, and the thyroid needs, and all the other tissues.
Yeah, I think some people, they don't even think they have a gut problem, because it's one of those things where they say, I don't have any symptoms. My gut works perfectly fine. I go to the bathroom every day. I don't have any bloating. I don't have any discomfort. I don't have any food sensitivities that they know of. And so they kind of sometimes just say, oh, no, I don't have a problem with that. And it gets pushed to the side because it's kind of, with your skin, if your skin's irritated, you can see it. Your gut, it can produce symptoms that you may not associated with gut function, and it can often get missed in a lot of health circumstances.
Yeah, I think the other thing to tie right into that is, sometimes we have GI issues, but we don't assume that we have a GI problem, right? So you're belching and burping. Well, everybody belches and burps. You should hear my brother-in-law. So I mean, but sorry, Steve, I didn't mean you. I'm just making a example, right? I'm not mean you. But a lot of people have gas and bloating and loose stools, or don't have a bowel movement for days, but they don't consider it a problem, right? Because they don't have a disease. It doesn't stop them from doing what they need to do. I guarantee you that at least one out of every 5 patients that I start have less than 1 to 2 bowel movements per day. I mean, it's super common. You ask people, how often do you have a bowel movement a day? It's normal. Okay, so how often a day? Well, I don't have one every day. Oh, well, how often do you go? Every 2 or 3 days. That's good. That is not good, because that means you're storing up. Either you're not eating, right, or you're burning up all the food that you're eating, or it's getting stored in the GI tract, and that's typically a recipe for problem. This is a tube that should move things along, not a storage center for waste. So
yeah, I often think about, and it makes sense when you think about it, but if you think about a dog or a baby, there's mechanisms in our system that when we eat, it moves things along. And so I'm just going to give an example of my dog. It eats its meal and then it wants to go outside, and it usually it goes number two. So, and that happens every single time the dog has a meal. And so humans are really no different. If you're eating, whether you're eating 3 meals a day or just even 2, if you're intermittent fasting, there should be more than one movement to get that stuff out, because there's that normal mechanism. When you eat food, it senses stuff in the lower GI tract to move it along, and you should have a bowel movement. If not, then there's a communication error going on.
Yeah, and that means things are getting distended to be able to maintain this volume of stuff coming in, but inappropriate amount of stuff going out, right? So we've got issues with when there's problems in the gut, you can have malabsorption of nutrients, and that becomes an issue. The other thing that's important is that the bacterial balance in the GI tract can be really important. Now we're still learning, right? We're constantly learning about what should be there, what shouldn't be there, concentrations, the species of organisms that should be there, what could and can't cause problems. I mean, for a period of time, we thought that only specific bacteria created or caused disease or dysfunction in the bowel. And now we know that lots of different bacteria, even what we call commensal or normal bacteria we expect to be in the GI tract, can create problems if it's too much or too little. So the bacterial load that we have in the GI tract becomes really important. But if you have the wrong types of bacteria overgrowing, or too much bacteria or too little of specific bacteria in the GI tract, it can create problems with malabsorption. It can create problems with driving inflammation. It can create problems with driving an immune response. And it can create problems that could potentially be the mechanism that triggers not just tissue damage, tissue disease, but also autoimmunity, whether it's within the gut or outside the gut as well.
Yeah, I definitely agree. And it's, there's so many components of the GI tract that we often think it's all just has to do with gut bacteria, that it's overgrowth or whatever it may be. But there's good bacteria and bad bacteria along the whole tract with it. And it starts in your mouth. And then obviously we have the stomach and the small intestine and the large intestine. And so there's so many breakdowns of where things can go off course. And so, more than just putting everybody into you've got a small intestinal issue, and stepping outside that, maybe it's got to do with stomach acid. Maybe it's got to do with you not chewing your food. Maybe we don't have the right flora in the mouth as well. So I think that there's so many different components that have not been researched, and we are still learning.
Yeah, so when somebody has a thyroid condition, right? And it doesn't matter where they are to me on the spectrum, and if you think differently, you can wade in here in a sec, but we talk about the hypothyroid spectrum. So tissue hypothyroidism due to cell danger response, the immune damage to the thyroid gland, and eventually glandular hypothyroidism, which your primary care or endocrinologist might diagnose. Many times, in my opinion, the glandular piece is the end stage, not the beginning of the problem. But if we have a unhealthy, or we have problems within the GI tract, the inflammation, the malabsorption, the dysbiosis in the GI tract, those could, what we see going on in the GI tract could be the trigger of a thyroid condition for a number of reasons. Because one is, if there's problems or imbalances in the GI tract, if the immune system is upregulated or inflammation is upregulated in the GI tract, that could be the beginning of the danger signals that create that cell danger response that creates some local deactivation, but eventually results in the activation of the immune response at the gland. So that can be a huge issue. The other issue is when we have the imbalance and you have malabsorption of things like iodine, iron, selenium, magnesium, a lot of the key nutrients that are, or micronutrients that are needed for thyroid hormone production, then you can have some challenges at the thyroid gland. And whether it is the lack of these nutrients being absorbed, or it is lack of them getting to the thyroid gland that creates hypothyroidism. I guess is arguable or debatable. I mean, if you don't have enough of these things coming into the system to produce thyroid hormone, we could say that's why the gland becomes hypothyroid. But again, if you don't have enough of those things coming in, maybe it's part of the immune response to say, hey, we don't have enough iron, we don't have enough iodine, we don't have enough of this stuff coming in. So maybe because we don't have it, maybe those mechanisms could actually activate or trigger the immune infiltration to say, hey, we got to shut down the gland because we don't have enough resources here to actually produce thyroid hormone. So either one of those mechanisms could occur.
I think that it's important to understand that the GI tract can either be a trigger for thyroid dysfunction, or it can be the result of, you know, when you have something going on with your thyroid, let's say it was something totally different that caused a disruption in your thyroid physiology, the lack of thyroid hormone then can lead to a digestive or a GI problem because we have slower motility and, you know, it kind of deregulates it. And so you can either have that as the trigger or the result, and sometimes it's both.
Yeah, which is tough, right? Because if you're thinking about it, like all thyroid problems start at the thyroid gland, right? We could take that argument and say, hey, the problem started at the thyroid gland, and maybe it did, right? Maybe something created some damage to the thyroid gland. You know what? That's another conversation. But let's say the damage occurred at the thyroid gland. Now the thyroid gland is being damaged. How would that impact gut function and gut physiology? Well, a couple of ways, right? If there's not enough thyroid hormone being made by the gland because it's become damaged, then you don't have enough thyroid hormone to support normal movement, motility, and functionality of the GI tract. You need thyroid hormone to produce stomach acid and stomach acid is a critical component to healthy GI function. You need thyroid hormone to support bile function and bile physiology. You need appropriate thyroid hormone to support pancreatic enzyme production and output. You need appropriate levels of thyroid hormone to support GI motility and function. And you need something from the thyroid glands called motilin to help with that, what we call the migrating migrating motor complex of the GI tract. So almost every step of GI physiology and function requires a level of thyroid hormone. So if the damage did occur or start at the thyroid gland, it could then create thyroid or GI dysfunction at multiple steps. And if it was the other way, where you had the bacterial imbalance, food intolerance, things that are actually creating imbalances or chaos in the GI tract first, then that's the scenario where you may start with a GI problem, now creating stress and inflammation, which creates that danger response, which causes the local deactivation of thyroid hormone, which then creates some signs, some symptoms, and that chronic cell stress response. You can start to see the release of those things, those damage-associated proteins, DAMPs, PAMPs, pathogen-associated proteins being leaked into the periphery. And those things are floating around to activate the immune system to say, hey, come help the GI tract heal and repair. And these are the things that are being damaged, but they can also bind to receptors on thyroid cells and initiate that the damage at the thyroid gland, or what we call the immune attack or Hashimoto's.
Yeah, definitely. And it's a complex pathway. And even some of the foods that we eat have been linked to dysfunction, whether it's something causing, you know, whether it's gluten or dairy or sugar causing inflammation, then that leads to that cell danger response. But even in some of the functional medicine circles, there's been even talk about, oh, well, the cruciferous vegetable family, if you eat too much of that, can cause damage. So even the foods we eat is linked through the GI tract that then can, you know, whether that's the amount that you would have to eat is astronomical. I don't necessarily, I believe that, but I do think that there is a food link, you know, but I think it's through the inflammation and the cell danger response that then causes some thyroid dysfunction.
Yeah, and in that situation, I think we would agree that if that's a protective adaptive mechanism, right? So if I have a chronic GI inflammatory process going on, slowing down metabolism and helping support the ramping up of defense is going to be a protective mechanism, not necessarily a mistake in physiology, right? So we'd say, if this is where if the process started. So one of those things to consider is, and since you mentioned it, is food, right? Food has the potential to create problems in the GI tract. So what do you see as kind of the big factors that may be problematic? Like big picture thinking, what are the more common things that may create some compromise or damage to the GI tract?
Yeah, I mean, I think that has to do with things that are foods that are not really found in nature. So really artificial foods or things that have been modified, you know, preservatives and things like that. That's gonna, your body doesn't recognize that as real food and it sometimes will attack it. We obviously know that there is a link between gluten and dairy between that, you know, a lot of our patients, when you remove that stuff, they do get better. So there is that link, the proteins that are involved with whether it's with gluten or we see that with the whey proteins, that people can have reactions to that. And then obviously sugar in itself, most people aren't sensitive to sugar, but we know that sugar causes a whole host of things where, you know, the insulin resistance and causes, you know, downstream inflammation. So, you know, those are the big things that I see that, you know, where people go wrong is they think that, oh, I'm just going to go on a gluten-free diet and everything should be better. Well, sometimes, and we've talked about this on the podcast before, going on a gluten-free diet isn't always healthy, or really getting rid of, you're kind of trading one bad thing for more preservatives. A lot of the gluten-free products out there are loaded with, you know, bad oils and, you know, fillers and maybe other grains that your body could still be sensitive to. I mean, there's cross-reactive grains that your body may think, you know, the proteins may look similar and your body may think that it is those. So I think that really when it comes to food, we have to put our investigational hat on and really, whether it's doing a test or really journaling and saying, okay, I ate these foods, this is how I felt, trying to figure out, you know, what those culprits are, because I mean, it is going to be totally different for every single person. And it's really figuring out those triggers. And sometimes it's more of an amount than it is the actual food itself.
Yeah, so like when people talk about what, you know, everybody gets stuck on gluten, right? Like it's the thing, right? Um, but I think one of the first things you said was probably the most important. And, you know, if you're focused, if you're trying to be healthy and if you have a thyroid issue and you're trying, okay, what should I be eating? I think the first thing to consider is, hey, you should be thinking about a whole food diet, right? Processing of food is probably one of the biggest problems we have, and especially the processing of our oils, the sugars. That's where probably most of the damage occurs. And especially, I don't think necessarily that the processing of our fats and oils gets as much attention as it should. I mean, we had, we had one of the, Peskin, Paul Peskin on, we talked about fats and how damaging of our oils and fats creates a ton of issues and toxicity and problems. And it just doesn't really get looked at. Sometimes people are so busy looking at gluten and dairy, which they may need to consider, but meanwhile they're taking, you know, using canola oil every day and processed soybean oil and all of these oils that are been oxidized, damaged, and can create reactivity and reactions in the body. And I think when you really start to look at the literature and the research of when chronic illness and chronic disease began, it probably started not as much with the processing of maybe gluten and sugar as really the correlation may be greater with the processing of our oils. And that may be one of those big issues. So for the person who's listening to this and saying, okay, but what should I be eating? I think we beat this to the, you know, dead so many times that really your initial focus, if you have a chronic health issue, we don't care what it is you should be focused on a whole food diet as your primary thing. And I think both of us would agree to some extent that, hey, if you want to be dogmatic and be 100%, that's awesome. But at least you need to consider, as a general rule, in my opinion, that 80% of your diet should be whole food based things. And if
Yeah.
you focus on that as your primary thing, it makes your life easier, right? You don't have to worry if it's gluten-free, dairy-free, whatever free. Hey, first of all, just get rid of the processing of foods. Get rid of the excess sugars, get rid of the processed oils. Don't use that stuff, or use it as little as humanly possible. But if you just got rid of those things and gave that time, that would probably be massively beneficial to your overall health and well-being. Your thoughts?
Yeah, no, I totally agree. And I think we've talked about this before on the podcast, is that it's the overall load. And so if you're still eating all this other processed food, but you get rid of gluten, that may not be enough for you to make headway in your challenges. If you work on the overall load and say, okay, I'm going to eliminate this over here and this here and this here, it may not be perfect, but at least you're reducing that overall load. And I think that mindset, when you're talking about somebody's diet, they can get very emotional about food. I mean, it's, we have a breakup, we have a death in the family, and that's what we go to is food as emotional support. So telling somebody, I'm going to take your emotional support away, can be very, very traumatic for them sometimes. So maybe switching the focus from, oh, we're going to take away all these things, to just, hey, let's focus on this. If you focus on these foods, it's going to eliminate them, but it's the mindset portion of it that people don't realize is, let's focus on the good, the things that we can eat, and kind of forget about the things that you're losing on the back end.
Yeah. And listen, we both get it. I mean, there's only so much willpower in the day. If there's stuff hanging around at 9 o'clock at night when you've already been, you had a really stressful day, you might not have enough willpower to not eat those things. So part of it comes down to just taking the 30,000-foot view and say, okay, let me take a look at what I'm eating on a regular basis, and let me start by cleaning that up and just getting less of this processed food in. There are arguments from people like, hey, it's more expensive to eat healthy food. I don't know how to cook. I don't know what to eat. It is less satisfying. I need to, there's lots of excuses, but at the end of the day, that's really what those things are, is just excuses, because we all make choices. It's just, yeah, it's easy to go get some, processed food meal, throw it in the oven and it's done. But at some point you're paying the price for poor dietary choices. And, despite what you see on commercials and TV, I think innately most of us know that most of the processed food that we're consuming, even if it says natural, if it says healthy on it, if it says gluten-free, if there's a lot of ingredients in the back of the package that you don't understand or you can't really pronounce, it's probably not that great for you. So I definitely think if you want to start with how do I help my thyroid physiology and my gut, definitely starting with a good 80% whole food diet. Then if you've done that and you're still having some struggles, then there's things like the AIP type of diets, right? Where we're removing gluten and dairy and soy and eggs and nuts and seeds, and we're removing some of the animal and plant-based foods that we're most likely to start having some sensitivity or reactivity to. So that would typically for me, that would be the next step for people.
Yeah, no, I totally agree. I think you start with just the things you have control over, just starting to reduce your overall load. If you're not getting where you need to be, then we need to think about moving into something very more restrictive, AIP, and sometimes that doesn't work for people. So sometimes, we've talked about the carnivore diet, and there's other, some people, it needs to be vegetarian. There's certain different avenues that you can go down that it's not everybody fits into this same bucket. And I see that where people have worked with functional medicine practitioners, and it's like, everybody has to do this diet. This is the best. There's no best diet. I think it's comes down to individualizing it for the person and figuring out what exactly works for them. And so that's really, really important to kind of decipher between that. And that's sometimes where working with a practitioner that's skilled in helping you navigate that, starting with the things you can, the reducing the overall load, getting gluten-free, reducing the sugars, do the things you can at home. I mean, if you haven't done that when you've come to me, we're going to start there. So why not go ahead and just get that out of the way? Try that, unless you really need somebody to handhold you during that. Try those things, because we're going to go down that path anyways when you come to a practitioner.
Yeah, and so a really good point there is that the diet is going to be probably that you need, maybe unique to you to some degree. We would say it's going to be healthy foods, but we've talked about the carnivore diet with multiple guests, and people have done really well with it. And one of the reasons is that sometimes plant matter, especially plant matter that's out of season, that's force ripened, can be extremely toxic. I mean, the short answer for people is animals can run, right? So they don't have to produce a lot of toxins in their body to fend us off, but plants can. So they have a tendency to produce more toxins. So humans, organisms, plants, or animals don't eat them when they're not supposed to, right? So the nuts, the seeds, the fruit eaten inappropriately, sometimes the leaves of the plant eaten out of season or when they're not ripe, can actually trigger some pretty sick behavior in somebody, trigger a lot of damage, inflammation. If you think about it, you go into, I heard this the other day, somebody say, if you walked into the jungle, right, and there's plants everywhere, but you probably can't eat any of them because almost all of them would make you sick if they're not processed and prepped appropriately, right? So some of those plants are there, and you need to understand how to process them, or they can be really make you very sick. But some people don't have the acid, the bile, the pancreatic enzymes to break down animal proteins as well. So they may eat those things and not feel well as well, or they may not have the bacteria to help process that stuff. So sometimes, regardless of what's considered a healthy diet, there's a mismatch between the food, the acids and enzymes, and the bacteria that don't allow you to break down even what might be considered healthy food.
Yeah, and I think that sometimes people get put into this they read a blog and they think that the AIP diet is, or the carnivore diet, whatever it may be,
elemental diet, SIBO diet, right?
They think that that's like the end all be all. And, I get, patients that come in that'll say, I don't understand why I'm not any better. I've been on AIP for a whole year now and I'm not any better. Well, maybe the AIP diet isn't for you. Maybe that's not the right thing. And they're like, no. I read a blog. I have autoimmune issues. I have RA, or I have Hashimoto's, and I have to be on an AIP diet. And I think that people try to put themselves into a bucket that, well, maybe if it's not working for you, we're either missing something, or maybe that's not the diet for you. And that can be some of the hardest things, is to get people, okay, let's try to add some of these things back in there when they've been told, like, no, I can't have that. I haven't had that for so long. And then there's a fear too that I'm going to get really sick if I start eating some of those other foods again. And so there's such an emotional and people want to stick to that diet. Like, I'm never going to change. And that can be hard for people to realize that, yes, you're eating this way. It's just, if you're eating the standard American diet and you're still feeling terrible, we got to change. Same thing goes if you're eating the AIP diet and you're doing it correctly. If you feel terrible, something's got to change. And we've got to look at, maybe you're not digesting it, or maybe that's not the diet for you.
Yeah, and maybe it's not enough, right? Just because you change the diet, that may not be enough to restore stomach acid production, to restore bile flow, to help the tight junctions heal and repair. I mean, there may be a lot more complexity. Sometimes there's problems in the GI tract that create enough problems that other systems that have to contribute to GI function become compromised. And not only do you have to change what's going on in the gut, but you actually have to support other tissues, right? So if the gut becomes a problem, the gut triggers immune inflammatory process that creates damage to the thyroid gland. You lose thyroid hormone production, you lose motilin production to help with the migrating motor complex. Yeah, you can work on the gut, but now I've got a thyroid gland that's been damaged maybe by 70, 80%, 90%, and I don't have enough thyroid hormone. Now I have to support thyroid physiology to help support the gut. So it becomes this vicious cycle to some degree. But I think sometimes people get that idea that I'm doing AIP, so that should fix things. But It may not, right? And definitely the diet you eat has an ability, it's going to change your gut biome, right? For the good or for bad, right? So if you change your diet sometimes to an AIP diet or an elemental diet or a carnivore or a vegetarian diet, you may see some initial benefit, right? Because you're changing the bacterial load in there or reducing maybe some inflammation. Um, and that may be good for a while, but then you plateau. So it's sometimes you gotta shift and you gotta multiply. And then the other thing we have to consider that sometimes making those dietary changes may not make you feel so good, which is important as well, because when you change what you eat, you change the bacterial load, right? Which then can create some change in, it can create some die-off response, some die-off reaction. Sometimes people who change their diet actually feel nauseous, sick, or just with the dietary change, because there's maybe a big change or slough or die-off of some of the organisms in the GI tract. Is that good or bad? I don't know. It depends on the individual person and what their experiences are, but it can be significant positive changes within, a couple of weeks to 30 days, or it could be a rocky road to making some of those changes, right?
Yeah, and they may think that they're getting worse. So I'm going to stop this diet. I got to go back to what I was eating. And, that's where working with a practitioner to, help work through those or help mediate some of those symptoms. I mean, there's things you can take it a little bit slower. Maybe there's a supplement that can help supplement to get you through that little transition period. So I think those are important things to keep in mind when you are changing your diet, especially, I see this big with people who try to go keto. Obviously there's dirty keto, there's clean keto. I mean, there's so many different variations of keto now that, if you're truly going from, burning sugar to burning fat, there is that transition period where you may get that keto flu and feel really, really terrible. And once you get on the other side, some people feel amazing and other people, they stop before they get there because they just are so miserable.
Yeah, so it's important to understand that anytime you make a significant change, diet, lifestyle, anything, there's going to be change, right? Whether it's good or bad depends, but that's sometimes where 1 or 2 days isn't a long enough time to make a valid decision. You need to hang in there, but it's not unusual that people go on carnivore diets, start to have loose bowels, or people that go on a vegetarian diet, they see a change in increased frequency or decreased frequency, because all of that really depends on multiple factors. So definitely dietary stuff is one of the things that's relatively easy, simple to do. May not necessarily be easy, but that is one of those things that can be really important in having an influence or change in gut physiology. Now, we get into some of the stuff that's maybe more important, and that is, what do you do if you have GI symptoms, right? What if I have gas and bloating and pressure? What should somebody be considering? Well, I would say if you already have gas, bloating, pressure, nausea, constipation, diarrhea, you have a functional GI disorder, and we probably need to explain the difference between what we consider and medicine considers a functional GI disorder versus a disease process. But if you have a functional GI disorder, that's where to me, you probably need to reach out for some help and support versus sometimes just throw in, just individual supplements because you don't really understand what's going on. So I guess the first thing is, if you have gas, diarrhea, bloating, constipation, lots of GI symptoms, and you go to maybe a gastroenterologist, they're going to assess you, and they're going to look for disease or pathology. So they're going to look for esophageal erosion and identify the disease process that's occurring, and then work to treat the diagnosis, right? If you have diarrhea, they're going to do some assessment, look for disease, celiac, Crohn's, colitis, right? Some type of disorder. They're going to maybe take a scope and look up from either end to see if there's disease or pathology. And if there is no disease or no pathology, then it's considered that you have a functional GI disorder. And when you have a functional GI disorder, then the recommendations are to treat the signs and symptoms and continue to run pathology tests until pathology is identified, and a diagnosis can be given, and you can have the problem cut out or medicated. You might be diagnosed with just reflux, with irritable bowel disease, right? Or not irritable bowel disease, I should say, not an inflammatory bowel disease, but irritable bowel syndrome, right? So, and that irritable bowel syndrome could be constipation, it could be diarrhea, or it could be mixed, right? It could be a combination of both of those things. But it's considered a functional GI disorder by medicine, and they're just gonna kind of treat symptoms, watch and wait. In functional medicine, we try and run functional based tests to actually assess what's going on in the GI tract. And there's a number of companies that run functional GI tests. Doctor's Data runs one, Genova Diagnostic runs one, Great Plains, GI Map from Diagnostic Solutions, Megabiome, I think is the company, or Microbiome Labs. They have a new test that's out. There's the Biome test that's out. So there's lots of these functional GI tests that measure bacterial concentrations, the types of bacteria, pathogenic, commensal, which is the bacteria we should see in the GI tract. They measure parasites and yeast and organisms, other organisms, viruses. They may look at markers of function of the GI tract, which is typically not what's looked at by your gastroenterologist. So we do see different types of testing in functional medicine because we want to get in there and try and see where's the imbalance lie versus in allopathic medicine where they're actually looking for the disease. You want to comment on that?
Yeah, no, I think that's, you know, the difference between traditional medicine and functional medicine when it comes to a functional GI issue is that they're just going to try to suppress your symptoms, mask it. That's traditional medicine for you. When we look at functional medicine, we want to find the why. We want to dig a little bit deeper. And I think that's where, if you're having some of those major symptoms, it may not be a hard pathology that they can, like, it's not like anything they can go in and just remove. It's, you've got to figure out what's triggering that and then try to heal it essentially. So, you know, running an appropriate test to really kind of fine tune it, because it's not just take a probiotic. And I think people really try to simplify it and say, oh, well, you know, if I've got all these symptoms, I just need to take a probiotic and that should fix everything. A lot of my patients, when they take probiotics, it makes them way worse. That tells us that something is going on with the spectrum of bacteria, that maybe you're overloading it, maybe there's not enough, or maybe there's too much, that we've got to work on, try to get that balance. And so I think that using a test to kind of fine tune your search, you know, putting your investigational hat on is really, really important. And it can be one component of what's going on in the GI tract. Obviously there's, like I said, there's many breakdowns, but that could be one trigger that reduces, if you can get that under control, it reduces that overall load. So, you know, I prefer the GI map test. I think you get for the cost versus the information we get that's usable. And I think that's really important too. There's so many tests out there, and some of them you can order, you know, just over the internet, and you whether it's a stool sample or a saliva sample that's going to test your microbiome, it has to be usable information. At the end of the day, you can run all these fancy tests, but if the information isn't going to lead to some sort of piece of information that then can be translated into action, I think they're often, you know, just a waste of money, and that you could spend your money better at certain tests. So really being frugal about what tests are run to get the most information that's usable for the patient and the practitioner, I think is going to be really, really important.
Yeah. So like if, for the listener, if you came to Erica's office or my office, or you were consulting with us, you know, one of the first things we would do is take a look at your signs and symptoms, right? Like, what are you experiencing? If you have gas and bloating and constipation, then we're already considering that there's a GI problem occurring. And you may say, okay, but did the GI problem cause my thyroid problem, or did my thyroid problem cause my GI problem? We may not be able to totally identify that, but that's where part 2 comes in, and that's looking at your health history and your timeline. So we can look, if we can go back maybe years or decades and look at what your health history tells us. If you're a person who started off early in life with lots of probiotics, right, or lots of antibiotics, I should say, and you had lots of things disrupting the gut biome early on, that may have been the beginning of the problem. You may not have had a thyroid issue yet, but that all those antibiotics that you had early on in life may have changed the gut biome. If you were C-section versus vaginally delivered, that would change your gut biome. If you were breastfed or bottle fed, that may have changed your gut biome. And those changes, and sometimes, like Dr. Erica said earlier, the load. Okay, mom wasn't very healthy. Mom had urinary tract issues. Mom had chronic infections. Mom had C-section. Mom then didn't breastfeed. You know, there's a common, it's the load. Now I've got chronic infections. So now I've got chronic strep. So now I'm getting antibiotics. Those things, you don't necessarily think about that may be the thing that caused a thyroid conditions in your 20s or 30s. But now we're learning more that one round of antibiotics can create issues to the gut biome that maybe doesn't manifest for decades. So that's really, really important to go back and look at your health history and your timeline. And then the third key thing, before we even look at the stool test, definitely for me, and I'm sure for you, is to look at a good, what we call a comprehensive blood chemistry panel, and look for indicators that not only indicate that there's problems in the GI tract, but then would make sense for what your signs and symptoms are. So we may look at that blood work and you would say, okay, which test specifically is going to tell me I have a GI problem? Well, not one of them specifically may exactly tell us that, but what we're really looking for is a pattern, right? So if we see markers like, hey, magnesium's deficient and my calcium's deficient and my vitamin D's deficient, and you see multiple markers that indicate malabsorption or nutritional deficiencies. There's multiple markers of B9 or B12 deficiency, right? Then you have to start to say, is it because the person has a terrible diet, or is it because they just can't absorb nutrients appropriately? And then we can start to say to that patient, even if they don't have signs and symptoms of a GI problem, that look, you have multiple markers of problem, right? You have multiple markers of malabsorption. You're taking a multivitamin. Maybe this is one of the reasons why, if you already have a thyroid disorder, that you have to keep taking a stronger and stronger dose of thyroid hormone. It never seems to normalize because you're not absorbing the thyroid hormone appropriately. So if we can see on a blood panel markers of malabsorption, that's one of those things. Then we might see some indicators of direct problem, like we might see an elevation of alkaline phosphatase, which may be an indication of inflammation in the GI tract. We may see markers of low protein and alterations of albumin and globulin, which may indicate to us GI inflammation. They may be indicators that there's low stomach acid production. So we take a look at the rest of the markers. We may look at a lipid panel to look and see, is there potential problems with fat malabsorption when we take a look at those markers. So we want to look at the comprehensive blood panel and not the Chem 14 that's often run, but really a more broader panel, and to say, okay, there's not one marker of malabsorption here, but 5. There's also 2 or 3 markers that indicate GI inflammation, right? So we've just confirmed that we have signs and symptoms of a GI problem, or we don't, but we do have markers of malabsorption and potential GI inflammation. That then justifies us either treating or taking a look at one of the multiple gut tests that are out there from a functional standpoint, right?
Yeah, absolutely.
And so, the next question might be like, which test do you have run, right? Well, that's where I think it's going to vary a little bit between practitioner, because each practitioner has a test that they feel really comfortable and experienced with running and interpreting, and that may be their test that they feel most comfortable with. They may feel more comfortable with a doctor's data test or a Genova's test or an organic acid test or the GI map test or a biome. I'm really comfortable. I can look at organic acids. I know you can as well. But I run a lot more of the GI map test because it's kind of I don't want to say a cleaner test, but when we get too much data, then you can get into the weeds as to what do I need to do. And I'm not looking necessarily, when I'm looking at the test, like, oh, this specific one. To me, that's less of a concern. Like, what's the specific organism? I just want to see that there's some imbalance and some chaos. How does that match to my patient's signs and symptoms? And then the next question for me isn't so much this specific organism, but what allowed this to occur. I want to see, is there appropriate stomach acid? Is there appropriate bile flow? Is there appropriate pancreatic enzymes? Are these things that are missing? Is the immune system not very strong, or is it overreactive, which could be a good thing because that means it's trying to react. So we want to look at not necessarily the specific organisms and say, well, this is the specific one that's causing my thyroid autoimmunity. I think, to me, we want to look at the big picture and say, hey, we've got an imbalance of the flora in here. Now we have to figure out, how do we restore the balance versus trying to treat one specific organism. Your thoughts?
Yeah, no, I think that's really important, that it's the big picture, not just, okay, I have H. pylori, let's treat H. pylori. I have this, let's treat that. I think that it's also asking, well, how did you get that? You know, is it because we don't have enough stomach acid? Is it, you know, were you exposed to some sort of pathogen? Is it the slow motility that's allowing these things to overgrow? So I think that, yes, I think those things need to be addressed, but I also think that the why question has to be asked too, because you don't just get that. There's a reason you were either exposed, the digestive system allowed that to happen. So asking those why questions are really important as well, because plenty of people come to me and say, oh, I've already had my SIBO, you know, treated, or I've had my H. pylori treated, but yet they still have that issue. So if you're getting rid of it, but then it comes right back, you've got to ask, well, something's being missed there.
Yeah, because I think people have this misconception at times that if you use a natural antimicrobial component that I got from my naturopathic or functional medicine doctor, that's not as damaging as potential as taking a antibiotic. There's an argument there, but both are antimicrobial, right? They're trying to kill organisms, and they're not necessarily specific, like, hey, we're only going to kill the bad guys, and we know exactly which is the bad guy. You're giving something that's trying to kill off bacteria. So if you're just trying to kill off bacteria or virus or parasites or organisms, and you're not addressing what we call the terrain, like what's going on within the GI tract itself, like, are we restoring the secretory IgA system? Are we supporting appropriate stomach acid? Are we asking why there's not enough stomach acid to begin with? Are we checking to see if there's good bile flow and what may be inhibiting bile flow? Do we need to provide some pancreatic enzyme support, and then ask the question, why do we not have enough pancreatic enzymes in the GI tract, right? It becomes, I think that's the challenge is that people are hopeful, doctors as well, that they're going to look at a test, see the bad guy organism and say, well, I'll just nuke that with some antimicrobial or antibiotic and life is good. Or somebody may say, well, I'm just going to take a probiotic and that'll fix it. It's usually not that simple. And that's why we wind up seeing people frustrated. They've spent, you know, hundreds, if not thousands of dollars on multiple different types of GI tests at different functional medicine practitioners, or they've gone to their allopathic physician and just constantly being told they have IBS, because even though they've had multiple treatments, because they're not asking that deeper question, why? Like, okay, if I constantly have H. pylori, there must be a reason, right? If I have constant reflux that requires me to take something all the time, why is that occurring? If I have bacterial imbalance in my small bowel, that what we call SIBO, right? What's allowing that bacteria to overgrow in the begin with? Shouldn't the immune system and the GI tract have systems in place to not allow that to overgrow? And the answer is yes. So something's inhibiting those systems from working. And, you know, we've both seen clients that have come from other practitioners, and sometimes people that are expected to be like experts or promote themselves as experts in their craft. And that little piece, I think, is sometimes missing. They've tried different ways just to kill the organism, but haven't looked at the terrain and asking the deeper question, why? Why is the SIBO keep coming back? What am I missing here that's not keeping the bacteria or the yeast or whatever the organism's is in check, and not allowing it, or and allowing it to overgrow, or not preventing the overgrowth?
Yeah, I think that's important because it's easy to throw a supplement or some sort of homeopathy at a bacteria, virus, pathogen, and it may get rid of it and you may retest it, it may be gone, but that doesn't mean that it's going to stay away. And I think that's the most frustrating thing to a patient is that 6 months down the road, all of a sudden they're back in square one, and then they're frustrated. They feel like they wasted all that money. And it's because the real like underlying thing that got them there in the first place was never addressed. And so it's again, looking at that huge picture and figuring out and asking, okay, you have this, let's work on that. But then we also have to ask the question and work on what got you there in the first place.
Yeah. And then, so then the next question may be, how long does it take to fix my gut, right? And we don't have that answer, right? For some people, they can have restoration of signs and symptoms fairly quickly. It doesn't mean we've restored the function and physiology of the gut appropriately. And so 30 days, 60 days, they're like, well, I feel good. I feel better. I'm going to go back to eating the way I was. And everything comes back again, right? So if there's still, the GI tract is pretty amazing because it can heal and repair given the opportunity, but you have to, and we've talked about this before, you have to reduce the danger response long enough to restore what we call cell-to-cell communication. So if the cells don't get rid of that dangerous response long enough that they can actually start to restore communication, then the gut's never really, even though the symptoms are down, maybe function's improved, but it's maybe not in a position where it's healthy and safe. And for the listeners who don't understand what I'm saying, if I was, with my family and somebody started like attacking me, or was with my friends and we got into a battle or a fight, well, we were all sitting around before communicating, having a good time, joking and telling stories. In the middle of being attacked, we're not having that same communication. Each one of us is in our own little world, fighting for our own survival. We're not talking to our friends and having jokes. We're like isolated in our own little problem. And the cells, your GI tract is like one cell layer thick. So you have this long line of cells and they communicate with each other when they're healthy. But when they don't when there's damage to the tissue or there's danger signs, bacterial imbalance, inflammation, though one of the first things those cells do is they stop that cell-to-cell communication and start only kind of functioning as an individual cell instead of this nice long tube. And so if you reduce some of that inflammation, but you don't get to the point where you've restored some of that cell-to-cell communication, I think that's what causes people to kind of resort right back to GI problems pretty quickly, is they don't hang in there long enough sometimes to really restore cell-to-cell communication.
Yeah, and I think that healing itself doesn't happen overnight. And when we think about the GI tract, it's like these little finger-like projections that help absorb nutrients, and oftentimes that get wore down to like nothing. And that could, think about if you had a soft tissue injury, let's just say it was a ligament or a tendon that you injured. It could be 6 to 10 months of really like healing. It takes time for your body to build those cells back up and to heal them. And so, although you may have reduced symptoms, it doesn't mean that you're fully healed. And like where you said, that's how you can slip back to some of those, symptoms very easily, is if you don't allow this stuff to fully heal. And it definitely just takes time. You don't heal overnight. It's not like you're going to go from, the term leaky gut to a really healthy gut overnight. That could take months, and I've even seen it take years for people of really healing their gut and working on it and really nourishing that gut to maintain it.
Yeah, because there's multiple factors that can play in there, right? Lack of sleep can be a stressor that creates problems in the GI tract. Emotional stress, trauma, food, toxins,
hormones.
Hormones. There's so many things that can create issues. So for some people, they may be like, oh my gosh, how am I ever going to fix it? You can really restore function, but sometimes it takes time. You have to hang in there long enough, and you have to be okay with some ebbs and flows in symptomatology, especially as diet changes and life changes a little bit. But it is something that can improve in time, but it's not as simple for the vast majority of people that I see hey, I'm just going to be gluten-free and that's going to fix it all. That usually is not, it can be beneficial, but it is not necessarily always the best, like the fix-all, right? Hey, gluten-free, it didn't work. Well, yeah, because you still have bacterial imbalance, you still have poor stomach acid production, poor bile physiology, you still have a damaged leaky gut, you still have a weakened immune system, or what we call a secretory IgA system. So yeah, you're going to react to a whole bunch of other stuff too. Anything you put in there, you're going to start to react to in time. And that happens sometimes to a lot of people. So I think one of those key things when we're talking about gut function, gut physiology is for the listener, and we're going to, because we're kind of working up on the hour of this one, we're probably going to do a part 2 on this. But what's really important for the listener is there's a massive tie to what happens in the gut, your thyroid physiology, and almost every other system in the body. We've talked about the connection between the gut and blood sugar problems, the gut and reactive hypoglycemia, the gut and insulin resistance. And so there's a huge tie to almost every other system in the body. So it becomes really important. Whether you think you have a thyroid or a gut problem or you don't have a gut problem, I would tell you if you have chronic hypothyroid symptoms or you've been diagnosed with Hashimoto's or you've been diagnosed with primary hypothyroidism, you owe it to yourself to have a skilled functional medicine practitioner evaluate your blood work, your health history, and maybe run a GI test to really assess it, because that's where you can make massive strides in a short period of time, is getting your gut and your GI tract under control. Even if you've had a gastroenterologist or medical doctor say you don't have a GI problem, you just have reflux or you just have IBS, and those things are being treated, they're treating disease and managing symptoms. Functional medicine should be different. And that is, we actually want to try and say, okay, if you have IBS, if you have irritable bowel, whether it's constipation or diarrhea, there's a functional problem. Your GI tract's not functioning well. And what we want to do is help you understand what is wrong with the GI tract so we can address it, so we can help it heal, we can restore communication, and you don't wind up developing the disease, inflammatory disease in the GI tract later, right?
Absolutely.
So I think we're gonna have to finish this part 2 because we both have work to do beyond this. So what we'll do is we'll do part 2 of this next, and you guys can tune back into this. If you're listening to this episode and you have questions or comments or concerns or thoughts regarding what we talked about in this one, reach out to Dr. Eric or myself at our websites. Mine's rejuvegencenter.com. Erica's is
brainandbodyhealthcenter.com.
Yeah, just put your questions in there, or wherever you watch the presentation, the video, just put a comment in there, a question, and we'll try and answer it on the part 2 of the thyroid gut connection. All right?
Absolutely.
Good. All right.
Yeah.
So we'll end this one. Have a great day in Winchester, and we'll talk soon. Okay.
We'll see you on the next one.
All right.
Bye.
Take care.